With an opioid epidemic at an all-time high, 25 million Americans may lose their health care. All right, so welcome back today with Dr. Mike McGee and myself, Brian. We are today having a few different topics, going back and forth on some. I don't know if you would, we talked about this the other day, but one of the topic is insurance and substance abuse treatment. So right now, if we eliminate Obamacare, old person glasses, here we go. Eliminating Obamacare, we're looking at 25 million Americans that would not have health insurance, health coverage, and removing the law's requirements for insurers to cover substance abuse services. So getting rid of Obamacare altogether without a viable plan in place, substance abuse treatment is going to go bye-bye as far as insurance goes, which seems kind of contrary to the government's whole direction as far as dealing with an opioid epidemic, and they love to publicize that. But how do you think that would affect recovery programs? I mean, with what's going on. It seems crazy.
Well, 25 million people is almost a tenth of the whole United States population.
Yeah.
So that means that basically if you're cutting insurance benefits for 10% of the entire population, that means you're going to see, probably a 10% reduction in treatment of people with opioid use disorder and other addictions. So.
Well, it seems crazy though, because we're talking about. I was going to talk about that in a minute. Purdue just paid out $270 million this week in the state of Oklahoma, and that's just one state,
right,
suing one pharmaceutical. There's four pharmaceutical companies that made OxyContin. Purdue was sued. They were going for $2 billion. Mm-hmm. The courts settled for $270 million. And yet we're going to eliminate, we've got all these settlements and we've got all these things regarding opiate addiction right now. And we're going to call it all treatment, at least funding for a lot of the people that probably need it.
Yeah.
I
think what's more, what really bothers me more is that they're cutting the mandate for basically insurance companies paying for addictions treatment. So that's going to affect all Americans because if insurance companies don't have to pay for addictions treatment,
they don't want to.
There's going to be less likelihood that they will. Yeah.
Absolutely crazy. Yeah. Well, I know we were talking a minute ago, I was out at the county jail actually earlier today, and I was talking with a person out there, alcoholism, the reason they're in there, and they were saying a majority of the people that they're having in there in the dorm with them, and the jail's overcrowded. There's people sleeping on the floor at the jail right now, but a lot of opiate, a lot of heroin, a lot of heroin cases, people in there for crimes directly related to heroin.
Right.
And, without treatment, it almost seems like we're fueling the criminal system.
Right.
And there is an NA meeting once a week at the county jail. There's an AA meeting once a week at the county jail. But, are we solving anything by simply locking people up?
No. Yeah.
No.
Yeah, it's interesting. I don't know that there's good evidence that locking people up is a good treatment for addictions. And there are some people who would argue that when you incarcerate people, the trauma of incarceration actually promotes addiction. So you're adding fuel to the flames of addiction when you respond to the legal issues of addiction with just incarceration.
I think we see that a lot in populations that we currently work with right now. I know that people that I've worked with since they were in youth authority and juvenile services, that sort of stuff, going through the system, they have learned antisocial traits.
Right.
They have learned every manipulative man. They've actually graduated, from JSC, juvenile services being like an elementary school. YA was high school, and then state penitentiary was college.
Yeah.
And then graduate school, they go to a SHU program.
Right.
We wonder why.
Right.
We've got people that at one point in their life are actually flourishing in a system that they shouldn't be flourishing.
Right. Right.
If it's truly meant to be a punishment, yet we've got people that are feeling like they've achieved something in life. And for a lot of those people, it's the first time they've ever achieved anything.
Right. It's really true. And it's not that I don't think that people shouldn't be locked up, and if they're out, damaging society and behaving in destructive ways and breaking laws, then there needs to be some sort of system for controlling and managing that. It's just that I don't know that punishment really works, especially with addiction. Mm-hmm. And if we were to lock people up, but with a whole different philosophy, with a whole different approach around treatment and rehabilitation, rather than around punishment, if that whole ethos of prisons was to change to a radically different culture, and a culture of caring, and a culture of compassion, rather than a culture of dehumanization and punishment, I think that society would be better off.
Yeah. Well, I definitely agree. I don't think, if you look at the data, the numbers, we haven't solved anything.
No.
And we've been incarcerating people for alcohol and drug problems since the end of Prohibition. Before Prohibition, when Prohibition was in effect. Mm-hmm. Mm-hmm. And
it's just the wrong solution.
Yeah.
It's the wrong approach.
And I have seen other countries that have changed their ideology, their way of thinking and dealing with these situations. Yeah. Portugal did a big change. Switzerland. Finland.
Yeah.
And the results look good.
They do. Yeah.
What's just sad is we're so ingrained in the way we've been doing things that I think a lot of times as a society, it's like, well, that's how we've always done it.
Right.
And sad part is the way we've always done it has never succeeded.
Right. It's time for a change.
Yeah.
Yeah.
Well, hopefully if you're watching this, you could be part of that change. Talk to people.
Write your congressperson.
Yeah. There's lots of areas we can be improving on this.
Yeah. Prison reform is just a huge opportunity for improvement, and we know better.
Yeah,
and there's other countries that we can follow suit. And,
I think prison reform is a huge opportunity to do better, but the amount of money that's involved that would cause a resistance against that change is a whole nother issue.
Well, that's why there needs to be a big force, a social force to push for this, because there are invested interests in continuing business as usual.
Oh yeah. Hey. They're traded on NASDAQ.
Right.
All right. Well, definitely look into that. And I think we're going to follow up on this one further down the line somewhere.
Look, Mom, no hands.